Regarding the cardiac signs, the heart is relatively large in respect to the chest, and the position of the heart in infants is more midline than older children. Heart murmurs are common during the first day of life. Most of these murmurs are transient. Pulses should be palpated in the upper and the lower extremities over the brachial and the femoral arteries. The normal heart rate is 120 to 160 beats per minute, and the variability in the heart rate is according to the baby's activity, crying, and wakefulness. A pulse rate of less than 100 beats per minute generally signifies low blood oxygen level. Concerning the gastrointestinal activity, first stool passed within 24 hours consists of meconium, which is greenish-black in color. 99% of normal-term neonates would have passed the meconium by 48 hours of life. By establishing breastfeeding, meconium is replaced by the transitional stools, which are greenish-brown in color. This occurs on the third or fourth day postnatal. Later, stools become golden yellow and may contain milk curds. The frequency of stooling is 3 to 5 motions per day by the end of the first week. Urine spots during the first 24 hours of life in more than 95% of normal-term infants. However, urination may be delayed up to 72 hours depending on the external atmospheric temperature. The newborn kidney is not fully able to concentrate urine, and the presence of abundant urates gives the diaper a pink staining. The reduced glomerular filtration rate may lead to drug retention and increase the drug toxicity. Regarding the hematological findings, hemoglobin level averages 17 to 19 grams per deciliter with mild reticulocytosis and normoblastemia. The total leukocyte count after the first 24 hours averages 25,000 per cubic milliliter with relative neutrophilia. After the first week of life, the total leukocyte count drops to 15,000 per cubic milliliter with relative lymphocytosis. High red blood cell mass results in indirect bilirubin overload on the liver with the development of physiologic jaundice. The newborn blinks at light. Pupillary light reflex is present at birth. Loud sound causes a blinking response, and nystagmus is observed on rotation. The newborn baby responds to pain by withdrawal and crying. What are the neonatal reflexes? These are inborn behavioral patterns that develop during uterine life. They should be fully present at birth and are gradually inhibited by higher centers in the brain during first 3 to 12 months of postnatal life. Neonatal reflexes will be further explained and discussed in the face-to-face session. For further readings and video demonstration of neonatal assessment and neonatal reflexes, you can refer to these links. Please be ready with your questions in the next face-to-face session.